The pandemic is gaining new strength here in the U.S. Dr. Fauci says the CDC is considering revising mask guidance for fully vaccinated people as Florida posts the worst outbreaks in the country. Victor Oquendo is at a vaccination site in Miami with the latest.
If you can hear me, make some noise.
This morning, the show goes on amid the spread of the Delta variant. Officials warning those who attended this hip-hop festival in South Florida about the rising number of coronavirus cases in the state. Florida recording 73,000 new cases last week, an average of more than 10,000 per day, now accounting for 1 in 5 cases in the U.S. New pop-up vaccination sites set up with demand ramping up. The White House and CDC reporting about 790,000 vaccinations nationwide over the weekend, possibly the biggest 24-hour period since early July. Nearly 60% of U.S. adults are fully vaccinated, but cases have skyrocketed 314% since mid-June, and hospitalizations are up by nearly 40%. The South is struggling. Florida, Arkansas, and Louisiana have the highest rates of infection in the country. This healthcare worker in Alabama is urging people to get vaccinated.
For me personally, I've never been as frustrated professionally as I am right now.
Nationwide, more than 25,000 patients are being treated for COVID in the hospital. Most are not vaccinated. And with the highly contagious Delta variant raging, the 3 largest school districts, New York, LA, and Chicago, requiring masks for students. Dr. Anthony Fauci confirming the administration is considering revising mask guidance for fully vaccinated people, but saying local authorities should make the call.
The CDC agrees with that ability and discretion capability to say, you know, you're in a situation where we're having a lot of dynamics of infection, so even if you are vaccinated, you should wear a mask. That's a local decision.
So far, more than 156 million American adults are fully vaccinated. There have been approximately 153,000 symptomatic breakthrough infections. That is according to unpublished CDC data obtained by ABC News. That is just 0.098% of those fully vaccinated. So while these cases happen, they are likely rare. Diane?
All right, ABC's Victor Oquendo, thank you. And to better understand where things stand with the coronavirus, let's bring in Dr. Alok Patel, physician at Stanford Children's Health, for more on this. Dr. Patel, thank you for being here as always. I want to start with the Delta variant because this new CDC data says symptomatic breakthrough COVID-19 infections are rare and represent about 0.09 to 8% of those fully vaccinated. So is there any concern about current vaccinations, and do you think that we could see boosters in the coming months?
Well, good morning, Diane. So I think 2 ways to look at this. So the first thing to understand is there's a big difference between a breakthrough COVID infection, which could be anyone who's vaccinated who just tests positive, versus the symptomatic ones that you were referring to, versus being hospitalized or dying, which you still have an extremely low, very improbable chance of doing if you're vaccinated. That's what people should be focusing on. Now, regarding booster shots, what the CDC is really talking about and where we may be headed is a booster shot for those who are above 65 or who have a weakened immune system, who may just need a little bit more protection as we're seeing these cases ramp up across the nation.
Now, right now, 59.8% of adult Americans are vaccinated, but we're still seeing cases and hospitalizations rising pretty significantly. Arkansas, Louisiana, Florida, those are the states with the highest infection rates. Where do we need to be for vaccinations to take enough effect that we stop at least seeing those rise in hospitalizations?
Well, I can answer this in past tense. Where we needed to be is getting the vaccinations rolled out to these vulnerable communities about a month ago, more than that. Because remember, this is a 2-dose series. After your second dose, you need 2 weeks to be fully vaccinated. And serious numbers like hospitalizations and deaths, Diane, are going to lag about 2 weeks after the rise in just reported positive cases. So in other words, we need to be on top of this right now, and it's extremely frustrating. I echo that early sentiment. This is a life-saving public health preventative measure, more effective than seatbelts, life jackets, helmets. This is more than 97% effective at preventing hospitalizations or death. So we really need both the health community, but also those local politicians to get on top of it in these states.
Now, the American Medical Association and the American Nurses Association joined up with 50 other healthcare organizations calling for mandatory vaccinations in their industry. Now, they're citing the rising case rates and the Delta variant as reasons for this, and they issued this big statement. I want to read you some pieces of it. It says, our healthcare organizations and societies advocate that all healthcare and long-term care employees require their workers to receive the COVID-19 vaccine. We hope all other employers across the country will follow our lead and implement effective policies to encourage vaccination. The health and safety of U.S. workers, families, communities, and the nation depends on it. Now, in one part they say encourage, in another part they talk about mandatory. Two different things, right? So how do you think? What do you make, first of all, of this message and the ongoing debate of whether people like employers and schools should mandate vaccine versus just encouraging them in certain industries?
Well, if we talk about, a place like a hospital or healthcare facility where you really are a frontline provider getting exposed all the time, 100% across the board, we should be encouraging it. I think it might be difficult to mandate it until we get that full FDA approval. But remember, we're not only talking about protecting the individual from getting vaccinated, we're also talking about the possibility that a vaccinated individual who's positive, may have mild symptoms or no symptoms, can still transmit it to other people. So you're protecting those around you, including all my patients who are below the age of 12 and can't get vaccinated. Now, regarding schools and other businesses, unequivocally, this should be encouraged. And I think the mandate will be easier, again, when we get that FDA approval, but also in looking what local outbreaks look like. And I think it's going to be a state-by-state scenario, which is frustrating, but we just know that that's how it's going to play out.
Now, the White House and the CDC are reporting 790,000 vaccinations occurred over the weekend. What do you think is contributing to the rise? Do you think people initially skeptical on getting the vaccine are now maybe coming around to it because this is higher than we've seen recently?
It is. And, I hate to say it's a silver lining in the outbreaks that have happened because, some people out there need to have a COVID-19 case really hit close to home in order to be like, hey, this is real. They need to see it hit their communities. That's very frustrating because we don't want to wait for that type of tragedy to occur to someone for them to then go out and take a preventative step. But that is what we suspect is happening in some of these areas. But also it's possible that some of the conservative or Republican voices who are now coming out and saying, hey, get the vaccine, Governor of Arkansas, Steve Scalise, people as Sean Hannity on Fox News, may be reaching some of that hesitant population. I wish they had done it sooner. We'll take what we can get, and I hope more of them, follow suit and stand on the side of science.
We're also seeing some areas respond to rising rates with reinstating mask mandates, even in some cases for people who are vaccinated. And we heard Dr. Fauci there hinting that we could start seeing more of that. Do you think that's necessary? And will this become a countrywide thing again, where we're all in masks again?
I think it's something that people should at least prepare for. People should at the very least keep masks on them at all times because you don't know what kind of situation you're going to walk into in a business. Now, I don't know if we'd actually get a national mask mandate that would be followed by every state. We just saw Missouri's, I believe, district attorney went against their state health officials saying that he would challenge a mask mandate. And so I don't know if this would be something that we'd even be able to get off the ground in a universal fashion. But I think it's important for people to understand that a mask, again, is not necessarily going to protect a vaccinated person from getting hospitalized. The vaccine does that, but it will prevent the transmission and further outbreaks. And so I do see an encouragement happening across the board, and I think it should be happening on a local level. And if there's a mandate in your area, please follow it because you know exactly what you're preventing.
All right, Dr. Patel, it's always great to have you. Thank you.
Likewise. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.